Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. We'll start today's show off with the same way we start most of our shows, a quick look at the COVID-19 statistics from the region. And we'll start things off with Peterborough City and County, Hiawatha and Curve Lake First Nations. 73 confirmed positive cases at this time, with more than 4,800 individuals currently tested. 2 deaths. 62 of the 73 cases have been resolved, and there are currently 2 institutional outbreaks. In the city of Kawartha Lakes, 139 confirmed cases, 2 probable cases, 46 current high-risk contacts, 9 hospitalizations, 107 out of 139 cases have been resolved, 32 confirmed deaths and 2 confirmed outbreaks. In Northumberland County, 14 confirmed cases, 12 current high-risk contacts, 1 hospitalization, 13 out of the 14 cases have been resolved. Dr. Lynn Mikula, Chief Medical Executive and Chief of Staff at the Peterborough Regional Health Centre, held a press briefing today to update the current situation at the health centre.
As of today's date, Peterborough Regional Health Centre has tested 4,000 people for COVID-19. In addition, in partnership with Peterborough County City Paramedics and Peterborough Public Health, more than 2,600 long-term care residents and staff have now been tested. PRHC's COVID-19 Mobile Assessment Plus Response Team has also visited a number of long-term care homes to provide additional resources and support. The hospital currently has 1 inpatient who has COVID-19 who is being cared for in the ICU. We have not identified any new cases among PRHC staff members, and all previous positive cases of COVID-19 in PRHC staff have now been declared resolved. We continue to actively screen for symptoms in all patients, visitors, and staff, and visitors to the health center continue to be restricted, with exceptions for safety reasons or on compassionate grounds. Last week, the Government of Ontario provided a framework to support hospitals in assessing their readiness and begin planning for the gradual resumption of scheduled surgeries and procedures while maintaining capacity to respond to COVID-19. In order to resume non-urgent care, specific readiness criteria must be met in both the community and the hospital. These include having a 30-day supply of PPE on hand at the hospital, the ability to maintain a certain amount of capacity within the hospital to meet a pandemic-related clinical surge, and developing a coordinated regional plan for resuming non-urgent care. Meeting these criteria to reopen will take thoughtful coordination and planning. Restarting the engine of healthcare won't happen overnight, and we also won't go back to where we were before quickly. We will have to stay ready for future surges, which means keeping the hospital's bed occupancy at about 85%. This might mean we aren't able to do as much as before. At PRHC, we are working to develop an appropriate plan that will meet the needs of our community and region and align with provincial direction. We're working with our partners on a coordinated regional approach. In the meantime, non-urgent appointments, tests, and procedures continue to be on hold at PRHC and across the province. If your non-urgent care has been delayed due to the COVID-19 pandemic and your symptoms are changing, please contact your care provider. The hospital remains open for emergency care, and we continue to have enhanced measures in place to prevent the spread of illness during the COVID-19 pandemic. For less urgent matters, please contact your primary care provider, who is still providing care virtually and, where needed, in person. I remain so very proud of the team at PRHC, who has continued to provide our patients with care under very different and difficult conditions throughout this pandemic, and who stand ready to support our community partners in whatever way we can. This week is National Nursing Week, and I'd like to send a special message of thanks to our nurses at PRHC for the incredible work they are doing in these unprecedented times.
Wednesday and Saturday nights will be missing something this summer in Peterborough. Today, MusicFest announced season 34 of the free festival will be postponed due to the COVID-19 pandemic. Brenda O'Brien, board chair for MusicFest, joins us to talk about the difficult decision and what this means for the festival moving forward.
This wasn't an easy decision. There was probably in the last 8 weeks, there's probably been 3 or 4 times where we've gone, is it right now? Should we do it? Can we hold on? Is there an alternative? It's just every week new news was coming out, or maybe we should say daily right now, news is coming out. And it was a tough decision. There was a lot of emotions. And last week I proofread the press release, and I can't say that there wasn't tears. It's disappointing. Our staff works so hard, and we've broken their hearts. Like, it's a passion. It's more than a job. It's a passion for people. And, I'm reading comments already on Facebook and social media saying, oh, we understand, but that's going to suck. Oh, it's going to be such a boring summer. And you don't realize, maybe until you lose something, the impact that you've had on people's lives, right?
Postpone is the key word coming from the MusicFest board, as they're avoiding the word canceled while taking this chance to plan for the future.
About what we're going to do, we believe our mandate is to put people in the park to listen to music. And so we are going to postpone season 34. We're not going to use that word cancel. We're not canceling season 34. With the good Lord willing, it will be next summer. And then after that, we will move into season 35. There's always a lot of work that, we run out of time to do because it is a small staff. And, funding may have to come from a different way. So is there grants we can work with? And, the government grants that we've got, the city, the county have all been very, very supportive. So, we continue to work on those and those relationships during this time. Just want to, share, and we're sharing in the disappointment with our fans and with our great volunteers. I could stop and, thank so many people, but, we share in that disappointment today, but we feel confident that we made the right decision. And we just absolutely cannot wait to get back. I guarantee that first concert that we're back in the park will be unbelievable. And we thank you for all your support and your continued support.
We'll certainly miss the atmosphere at Del Prairie Park this summer. Post-secondary institutions are developing multiple scenarios to prepare for the fall term. Jay Amer spoke to both Trent University President Dr. Leo Grork and Fleming College President Maureen Adamson on Politically Speaking about what September will look like.
I would say that we're certainly bulking up on online programming. Some of the online that we ended up doing in the end of this term was a bit makeshift. It had to be in 3 days. We went from in-person classes to online. We will be much better prepared for the fall, though we are expecting to offer some in-person classes as well.
Leo, Trent University was primary liberal arts school. It's actually evolved where you've got a big science component, a lot more hands-on and laboratory activities. And some people might think that, it will be a lot easier from the university academic point of view. But I know at the college, which is, always counted on practical experience and hands-on, I think these challenges probably exist at both schools. And I'm just going to slide over to Maureen here and tell us, Maureen, how you will be impacted, because you've got, there's a picture behind me of that Kawartha Trade Center. It's pretty hard to do some online learning there, but it might be possible. But what's the approach you'll be taking when it comes to distant and online learning for Fleming?
Yeah, it's a great question, Jay. So, when we had to do our pivot to online, we were able to do that for about 70% of our programs. There are things like welding that you just cannot deliver online. And so our first priority for the fall is to create safe environments to bring some of those winter students back and make sure that they can finish their courses at a appropriately physically distanced arrangement within that very center that you are mentioning. So we're going to try to do that. But it is very difficult, and we weren't able to deliver all online, and we're trying to make that up through what we're calling boot camps for the fall. And there are some things that are just quite difficult to deliver in that way in a vocational institution.
You can catch the full interview on Politically Speaking. Tune in Wednesday night at 7 p.m. right here on your TV. Paul Rellinger, host of Peterborough Matters, spoke to Peterborough Mayor Diane Therrien, who says one aspect of downtown shopping may not be received as warmly as it was in the past.
One, indication that we're returning to some kind of level of normalcy slowly, although probably not the one people prefer, is that downtown parking enforcement is being started again. And why now? I'm not saying that's a good thing or a bad thing. I really have no opinion on it at all. But is there a reason why that's happening now, and is it part of a determined plan moving forward?
So from the staff sort of perspective and recommendation, it was tied into the announcements from the province about the sort of gradual reopening of businesses and curbside pickups. And so, part of the issue that we have with downtown parking, and part of the reason that there's a 2-hour limit, is that you want to ensure that there's turnover, and that folks that aren't just parking there all day. And so part of the reinstating the enforcement was to make sure that businesses that are going to be able to reopen are going to be able to have parking out front of their doors, and that employees or other folks aren't necessarily just parking there and staying there. So, because the revenue piece is minimal that we make from that. So it is more about ensuring that businesses that are going to reopen are able to offer that parking.
And you can catch Peterborough Matters Wednesday nights, 7:30, right here on Your TV Peterborough. Ontario Premier Doug Ford announced today the House will convene to discuss extending the emergency order to June 2nd, and promised more information will be released on Thursday.
Today, we call back the House to pass important legislation as we continue to reopen the economy. I want to thank all the parties for their support and cooperation. Today, we'll be asking the House to extend the declaration of the emergency order until June the 2nd. This extension will also continue enforcing important public health measures. And while we've made significant progress, we still have a long way to go. But we also have many reasons to be hopeful. We're making steady progress. On Sunday, we saw the lowest daily number of new cases since March 31st. Our hospitals have added over 5,000 acute care beds. We're continuing to ramp up testing. If we stay the course, we will soon be ready to take the next step. And now is the time to prepare. We're talking to our business owners and job creators. Their input is helping us inform our next steps and the barriers we need to remove to ensure they can succeed in this new environment. We now have over 80 workplace safety guidelines to help our employers keep their staff and customers safe. We're building a solid foundation for the cautious reopening of our province. We're charting a path to a strong recovery. With the progress we've made, I'm confident we can move forward. On Thursday, we will share more good news. More good news about getting people back to work. More good news about opening workplaces, getting paychecks out the door. More good news about slowly getting back to normal. On Thursday, we will share more details about the next stage of reopening our province. We'll be reopening more low-risk workplaces, seasonal businesses, and essential services. We can get more people back to work. We have been through a lot these past few weeks. We have sacrificed so much. We've lost loved ones in this fight, but we remain resilient and unbreakable. And this has made us stronger, more united than ever before. Together, we'll face our future. We will rebuild what we have lost and more. Thank you, and God bless the people of Ontario.
Prime Minister Justin Trudeau addressed the nation today and says the federal government will help seniors with a one-time tax-free payment of $300 for those eligible for the old age supplement and $200 for seniors eligible for the guaranteed income supplement. He also adds we'll have to look at the way we care for seniors in Canada.
First, if you're receiving old age security, you will get an additional $300 to offset some of the extra costs you've had to cover because of the virus. This means that across the country, almost 7 million seniors will get help that they need. And to better support the most vulnerable seniors, we will also give an extra $200 to people who are eligible for the Guaranteed Income Supplement. So if you're receiving both OAS and GIS, you will get an additional $500 in total to help you. Our government is also investing an additional $20 million in the New Horizons for Seniors program. A few weeks ago, we boosted funding so that organizations could provide delivery services and help seniors stay in touch with family during the pandemic. So we're making another investment today to create more programs to help isolated seniors and improve their quality of life. Now, there's no question that COVID-19 has been taking its toll on seniors both emotionally and financially. And with today's announcement, our government is taking action to alleviate some of the stress they may be feeling. But there's a lot more work to be done, not only to find short-term fixes, but long-term solutions. COVID-19 has exposed some uncomfortable truths about our society, including how we care for seniors in Canada. We've seen heartbreaking tragedies in long-term care facilities and nursing homes right across the country. Overworked staff, understaffed residences, grieving families. There are serious underlying challenges facing these facilities, and in the coming months, the federal government will be there to help the provinces find lasting solutions.
Tomorrow, Kawartha Lakes Food Share is hosting a citywide drive-through food drive. More than a dozen locations around the city of Kawartha Lakes will be set up to receive food donations where you can drive up and drop off without leaving your vehicle. The food drive runs between 10 a.m. and 2 p.m. and all food collected stays within the community it was collected in.
Our drive-through food drive coming up on May 13th. It's basically a City of Kawartha Lakes wide answer to our Lindsay drive-through food drive that we did last month. So we're having people come, they get to drive through the food drive, literally just roll down their window, put their donation out, and then not have to worry about any kind of social distancing issues. People don't have to worry that they're going to be unsafe while they're donating. We do have a large needs list at this point. It's generally everything, but we have a couple of things that we have absolutely none of in our distribution center. So we're looking for things like baby formula, things like laundry detergent, different cleaning products, so that hopefully we can send those home with our clients. We do also need to make sure that these products are within date and that they are non-perishable. If these donations are coming in, we need to let them sit for 7 days without anybody touching them. So if there's anything perishable within those donations, we're not going to get to it for 7 days. So things are unfortunately going to rot. So we don't want that. We've got locations as far north as Kinmount, as far to each of the sides of our location, as far out as Little Britain and Janetville, and we tried to cover as much of the city of Kawartha Lakes as possible. So it's going to take place on May 13th from 10 until 2 at all of the 13 locations all around the city of Kawartha Lakes. So if people are unable to get out to the donation locations on the day of the food drive, if you can go to our website, www.kawarthalakesfoodsource.com, to find a food bank. All of their contact information is on there, so you just call up whichever location is closest to you, and you can get that donation to that location. Thank you.
As COVID-19 local impact continues on your TV, we'll get an update from Northumberland County. Hello and welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. Last week we brought you the story of the Northumberland Hills Hospital Foundation raising more than $3.4 million. Today we catch up with the Foundation's Executive Director, Rhonda Cunningham, to talk about how the Foundation reevaluated their goals for the upcoming year due to COVID-19.
And our entire staff team is working remotely at this point, so we're all in our home offices, but we have not stopped working towards meeting this year's objectives. So in hindsight, like the pandemic arriving right at the very beginning of our fiscal year has allowed the board to sort of we just were in the process of waiting to approve our budget on April the 8th. Well, we were able to amend our budget, and that's going to be before the board April 29th now. So we're very thankful in some respects that this has happened at the beginning of the fiscal year, because we can adjust our planning accordingly. The year that we're in right now, we had made a commitment to the hospital to fund $1 million in equipment needs over the next 12 months. $250,000 towards drug dispensing units, $150,000 towards surgical scopes, $300,000 towards what we call evergreen or IT projects, and $300,000 for contingency, items that may break down during the year that need to be replaced, and maybe they're not even on our radar. But it's good planning to have a contingency budget to allow us to react to those situations as they arise. So because we've made the decision to postpone all of our special events until the end of the summer, we're anticipating that our revenue is going to be down significantly this fiscal year. So it's going to be a challenge for us to be able to meet that $1 million objective. Even though it's quite, we raised $3.4 million at March 31st. We had committed $1 million this year because really we're in the very beginning phases of a long-term strategy to be able to address some of the more significant equipment requirements coming up down the road. So for instance, in the next 3 to 5 years out, there's a need to invest over $8 million in diagnostic imaging equipment. You can appreciate that, you just can't often raise $8 million in a cycle of 12 months. So our plan this year was to start to save money to be able to direct those larger capital requirements in the future. So unfortunately, we may not get too far into our savings, but you know what? We'll just have to do the best that we possibly can. And I'm quite optimistic that the community will rally around the hospital and help us through this time.
What have you learned about the foundation side and trying to reach out to the community and raise some needed funds for the hospital during this time as well?
Everybody's got their oars in the water, and we're doing everything that we can to make sure that the foundation does everything in its power to be able to support the hospital at this critical time. Our volunteers are outstanding. Our board members are really extremely supportive, and our staff team, we're all doing what we can and approaching it from a lens of curiosity and how can we do things different. And that's going to be what gets us through this. And this is what's going to mean we come out stronger on the other side.
Northumberland Peterborough South MPP David Piccini will be hosting sector-specific consultations with industry stakeholders across the riding to discuss the impact the COVID-19 pandemic has had on our local economy. Your TV's Mark Rockburn catches up with MPP Piccini to find out more about the consultations.
So working in collaboration with our chambers, industry leaders, different levels of government, I'll be launching sector-specific consultations across Northumberland, Peterborough South, bringing in feedback from, as I said, experts in our community, which will guide our jobs and recovery committee. Now, ingenuity, innovation, and creativity got our businesses in Northumberland, Peterborough South to where they are today. And I'm relying on that same prowess to guide our feedback and to guide the steps and actions taken at our Jobs and Recovery Committee to ensure that as we reopen this economy following COVID-19, we're doing the right things to support business, to ensure that they get back up on their 2 feet. And for me, it's important that we get a wide range of feedback across Northumberland, Peterborough South. So I'm really excited to do this, really excited to launch this. Folks can go on my website, my website is davidpiccinimpp.ca/recovery to sign up for the sector that most affects you.
Who do you want to hear from the most in this? everybody or just the business people? Because I know you're hosting town halls where you're opening that avenue so residents can jump on board to hear from. But with these specific ones, are you looking just to hear from in specific groups such as the manufacturing, tourism, agriculture, and such?
Yeah, it's a good point. So, I mean, encompassed in these sectors isn't just the traditional notion of I'm a business owner or a shopkeeper. I mean, I could be a farmer, you could run a theater, a non-for-profit. You will have a home in these sector-specific consultations. Now, to your point, I mean, yes, I think too often bureaucrats and government employees speak on behalf of businesses. Our businesses don't want to hear from government bureaucrats. They want to be able to provide direct feedback and guide our response. And for me, it's important to listen directly to them and that they guide our recovery. And, you know, I sympathize and understand the challenges they're facing. And I know it's rich hearing from a politician during these times. And, you know, when I got elected, I've really endeavored to get out and to try and do things in a non-traditional manner. You know, I come from a different background, not in politics, family, a small business owner. My dad's a small business owner, and I understand, you know, worked in small business to help pay my way through university in a deli. So, you know, understand the challenges that small businesses are in, but most I have a real fundamental appreciation for the remarkable work ethic of our small businesses across Peterborough South and want to lean on them. I mean, I'll be the first to say, I'm not the expert, they are. And I need to hear from them as we guide recovery in a manner that best supports them, given the unique realities we find ourselves in rural Ontario.
That's the show for today. For Your TV, I'm Dan Malta, and we'll see you tomorrow.